Creole community. How can I express my feelings to these people? You think they're gonna talk to their partner and said, you need to be in PrEP? No, we're not doing that. And it's great that, we have all this social media involved, but we need to bring all these females. They are the ones who need to lead us and tell us what do we need to do in the community. And the Latino community, we are so behind on talking about sex. We are afraid. I have these ladies, I'm talking about different ages. I said, oh, my partner doesn't know that I come to this group. And I said, okay, you are positive. How are you gonna get them involved into getting into PrEP? And I said, oh, can I bring you to this team? Can you talk to them about PrEP? So we try to engage other people into this and open the forum into these partners and letting them know not to identify this HIV positive woman, that they also need to be into PrEP. It's a very difficult situation that has been going on. I've been into the HIV business, also in the community for what? I don't want to say it because, but for many years. And I see that every day. I speak to the Haitian community, and it's the same thing like Dr. Mentel says, how are we bringing them to the table? And I said, don't be afraid. I can talk to you. CDOs, are doing a great job, but how are we meeting the goals of getting these partners involved? And that's our role. As a Latina woman, I need to speak at the same level. I'm a Latina woman, I'm proud to be Latina, and I'm proud that finally, my company is doing something different, that I said, we have to make a difference. We want to work with all of you. And that's what we're here for, to find a solution. How are we gonna get together to resolve these issues? How are we gonna talk about sex? Listen, how difficult is to talk about sex? Having sex is not the difficult part, but talk about sex, that is the most difficult part.
You may have a woman, and some women, they may think, oh, PrEP or Truvada is for women that are having multiple partners, or Truvada is just something we take just to have sex with many people, okay? So we need to remove our own judgment and to say, oh, no, I don't want to provide Truvada, or I shouldn't tell you about PrEP because I don't believe in it. It's not about me, because by you telling somebody about PrEP, you're actually giving them the option. Because once they contract HIV, they have to be on treatment. Okay, so being on Truvada, PrEP is an option. So don't let your own judgment or your thought about Truvada block you from sharing that there is something out there that can help prevent HIV. I've always said treatment is better than cure. So get the word out there to help, prevent HIV.
An essential step that we need to take is to educate our elected officials, right? Because they're the lawmakers, they're the policymakers, and we need to have appropriate insurance. And if we want to expand services, we need money. We need laws to be changed. So we need to be knocking on their doors and educating them. And we can begin implementing listening tours in our community, being really well versed on what the issues are, and working with your partners and working with your health department to know the epi data so that you can present that to them when you go to visit them, so that we can enact legislation that will benefit all of our health. Secondly, as I mentioned earlier, the Me Too movement, the Women's March movement. The Women's March movement started on Facebook with a woman in Hawaii who, the night of the election of the 45th, said, wouldn't it be great, this is terrible, and, we've got to do something, and why don't we go and demonstrate the day after inauguration? The next morning she woke up and there was something like maybe 12,000 hits that people said they agreed. Meanwhile, on the East Coast, Bob Bland, I don't know if you know about her, she is a fashion designer, and she started Nasty Woman and created those shirts. Well, she did the same thing, and there were more like 4 million responses. And that's how that got, propelled and started moving. If they can be successful with that, you know, and we could do the same thing with women's health and be inclusive of everything that we need that makes us whole, you know. So we need to, you know, I like I said, I'm standing up for change, stand up for change, come up with some kind of, you know, happening. But everybody is on social media. Everybody. So, you know, I know, you know, and I see everybody here, you know, you're looking at your phones, I don't know if you're communicating about the content of this meeting and what you're hearing or your impressions, but that is so powerful. That's a powerful tool, you know, and that's one way of breaking and going beyond, you know, the barriers and challenging stigma and reducing that. The third thing that we can do, and we heard this from Ileana and Araya this morning in their presentation, is that we need to go in and educate our medical providers, you know, our public health institutions, the staff, you know, about, and we really need to invite them in to talk about cultural competence. Because you hire someone that might be a transgender or maybe a woman, doesn't make them, or maybe, you know, it doesn't make them the expert. Because you're not an expert on all things. You know? So we need to consider that, and I haven't seen that happen. I've been involved in HIV/AIDS since 1982. And I have never seen that happen. Maybe in the beginning, we did, because I was at Lincoln Hospital at the time when we saw our first case. This was 1982. And of course, there was a lot of stigma, there was a lot of fear, people didn't want to treat patients, you know. And so we had to educate ourselves because we were committed. We all took an oath, you know, to take care of their health needs. So we need to think about this. There's a lot of lessons learned. We can look at also the civil rights movement, and there are a lot of lessons that we can learn from Dr. King about how to engage community and mobilize community. Because as Cynthia said, we need to go back to basics. You know, we've gotten away from that. We've become complacent, and you know, it's become an 8 to 5 or a 9 to 5 job, and that's it.
And ask them to do a run through at a doctor's office, give them a general checklist, ask about this, ask about this, ask about this, and ask them to share their experience. And then hopefully that will become popular. Now we have waist trainers that are popular, we have bundles that are popular. Let's make going to the doctor popular. Let's find a popular opinion leader and advertise. I went to the doctor today and I asked about this. Here's Olympia, she's in stirrups and she's talking about her with her doctor. Say how popular opinion leader. She's sharing her story with you all, so maybe when you all come in stirrups, she'll say, oh, she did talk about PrEP while she was in stirrups. Let me ask my doctor about PrEP while I'm in stirrups as well. So find your popular opinion leader, find them out in the South and use them for their strength. And their strength is breaking the news.
I would say a woman who is in charge of her sexual health talking to another woman is so impactful. It's so powerful because you can share things that she may not get from someone who's on the same page with her. When I speak to women, I speak to all women, and I most definitely include transgender women because transgender women are the women that men are sleeping with and then coming home to their women, their heterosexual relationships in their mind. So I always include trans women with heterosexual women. I think when we're able to speak from the perspective of we have done, the impact is greater. It's more sound than trying to figure out. If I've gone through the experience and I can share with you what it is and address your needs, women care for everybody, as Evelyn just said. So if I'm caring for you and I'm listening to you talk about you're having a problem with your light bill or daycare, and I'm able to give you some resources, after I address your concerns, you're going to hear me. And you may be more apt to getting some help for yourself. So we have to think of non-traditional ways to get this information out and to do our parts in making sure it goes out.
Well, first of all, I have a question. How many of you all have an interaction with clients on a day-to-day basis? In group settings, informal settings? You all do. So, well, you all don't know. Calithia, she's also my personal mentor, and also she was my prevention program manager. You know, that's a tongue tie. One thing that we do a lot is cocktails and cuisine. Well, that allows us to have an informal conversation. So that means, excuse me, plug your ears, Christian, we're allowed to say fuck, big ass, and all of that. Because we're coming to you in a more informal yet layman's way. Oftentimes you don't want to talk to your doctor because your doctor's going to talk to you like this, and he's going to be like this. So you want someone that's a ground worker who, like you said, that comes from a place of I've been there, I understand, so let me give it to you this way. And if we give it to them that way, it's more likely a chance that they will disseminate the message to their social circle. So we found that to be very creative. We found that to be effective, and I like to pay attention to lobby conversation after it's over. If they're still talking about the experience that they just had, you have a successful event. If they're talking about going to cocktails after, we think that event you can try it again. So cocktails and cuisine, I think you all should bookmark that and make that effective.
Target a popular leader, and I was just wondering. I said, "Does Oprah Winfrey know about PrEP?" I'm like, "What if I asked her, like, Oprah, do you know what PrEP is?" And we need women like that in our community that can have a powerful impact on women. And especially, I'm trying to get at Alicia Keys right now, but I'm still no success. So I'm trying to get to her, but you know, we need people like that in our community to be able to use our strength to empower our community. Because once the word get out, then everybody's gonna be curious. And like I said, everyone should know about PrEP. Even a 2-year-old should be talking about PrEP.
This morning, I talked about empowerment to you in the open address. And I feel that every woman in this room is a champion, is a celebrity, and is a star. Yes. I don't agree that we need an Alicia Keys or Oprah Winfrey, to speak on behalf of all women.
No, neither, right?
Here, you all have a voice. But
I think I'm so proud and my sister Roosevelt spoke
eloquently about storytelling.
and women are the best storytellers.
Aren't we?
Yeah.
That's how we learn, and that's how we teach our children and other family members, extended family members, and blended family members. So I challenge all of you to think about, as we, move into the breakout sessions in the afternoon, to think about storytelling and think about what kind of innovative ideas, ways we can market women's sexual health. How can we market PrEP and PEP and condoms and everything that's in that toolbox through storytelling?